The U.S. is facing a serious crisis of inadequate psychiatric care. Millions of people with mental illnesses are unable to access the treatment they need because of a shortage of psychiatric beds and community mental health services. This has devastating consequences for individuals, families, and society. According to the American Psychiatric Association, the U.S. has only 11.5 psychiatric beds per 100,000 people. This is far below the recommended minimum of 50 beds per 100,000 people. The situation has worsened during the pandemic, as many psychiatric facilities have reduced their capacity or closed due to infection risks and financial pressures. The lack of psychiatric beds means that many people with mental illnesses end up in inappropriate settings, such as emergency rooms, jails, or the streets. A study in California found that more than half of the patients who needed psychiatric hospitalization were denied admission due to bed shortages. Many of them had to wait for days or weeks in emergency rooms, where they received inadequate care and faced stigma and discrimination. Another study estimated that about 20% of the inmates in U.S. jails and prisons have a serious mental illness. Many of them were arrested for minor offenses, such as trespassing, disorderly conduct, or drug possession, that were related to their untreated symptoms. Once incarcerated, they often face harsh conditions, violence, and isolation, which can worsen their mental health. They also have limited access to psychiatric treatment and medication in jail, and face difficulties in transitioning to community care after release. The shortage of psychiatric beds and community mental health services in the U.S. is a human rights violation and a public health emergency. It deprives people with mental illnesses of their dignity, freedom, and well-being. It also costs the society billions of dollars in lost productivity, increased crime, and higher health care expenses. It is urgent that the U.S. invests more resources and reforms its policies to ensure that everyone who needs psychiatric care can receive it in a timely, appropriate, and humane manner. Many mentally ill people who end up in jail face harsh and inhumane conditions that worsen their condition and violate their human rights. One of the most common and cruel practices is solitary confinement, where inmates are isolated in a small cell for 22 to 24 hours a day, with little or no human contact, stimulation, or natural light. Solitary confinement can cause severe psychological distress, such as anxiety, depression, paranoia, hallucinations, and suicidal thoughts. It can also exacerbate existing mental illnesses or trigger new ones. Studies have shown that solitary confinement can damage the brain and impair cognitive functioning. Yet, many jails use solitary confinement as a way to manage mentally ill inmates who are seen as disruptive, violent, or non-compliant. Another problem that mentally ill inmates face in jail is neglect. Many jails lack adequate staff, training, resources, and facilities to provide proper mental health care and treatment to inmates. As a result, many mentally ill inmates do not receive regular screening, diagnosis, counseling, medication, or therapy. Some inmates may not even have access to basic hygiene items, such as soap, toothpaste, or clean clothes. Without proper care and support, mentally ill inmates may deteriorate physically and mentally, and may develop chronic or life-threatening conditions. A third issue that mentally ill inmates face in jail is abuse. Many mentally ill inmates are subjected to physical, verbal, sexual, or emotional abuse by other inmates or staff. They may be beaten, raped, mocked, humiliated, or threatened. They may also be denied food, water, medical attention, or other necessities. Abuse can cause severe trauma, pain, injury, or death to mentally ill inmates. It can also erode their dignity, self-esteem, and sense of safety. In summary, mentally ill inmates face harsh and inhumane conditions in jail that violate their human rights and worsen their mental health. They are often subjected to solitary confinement, neglect, abuse, and lack of proper medication. These conditions can cause serious harm to their physical and mental well-being and may lead to irreversible damage or death. Therefore, it is urgent and necessary to reform the criminal justice system and provide alternatives to incarceration for mentally ill people who need treatment and care instead of punishment. The problem of jailing the mentally ill is not only unjust, but also costly and ineffective. It does not address the root causes of their behavior, and it exposes them to further trauma and violence in prison. Fortunately, there are some alternatives and reforms that have been proposed or implemented to address this problem, such as mental health courts, diversion programs, specialized prison units, and more funding for psychiatric facilities. Mental health courts are specialized courts that offer treatment instead of incarceration for people with mental illnesses who commit non-violent crimes. They are supervised by judges who work with mental health professionals and social workers to create individualized treatment plans for each participant. The goal is to reduce recidivism, improve mental health outcomes, and save money by diverting people from the criminal justice system. According to a study by the Council of State Governments Justice Center, mental health court participants were 25% less likely to be rearrested than a comparison group. Diversion programs are another way to prevent people with mental illnesses from entering or staying in jail. They can take place at different stages of the criminal justice process, such as pre-arrest, pre-trial, or post-conviction. They involve the collaboration of law enforcement, mental health providers, and community agencies to identify and refer eligible individuals to appropriate services and support. For example, specialized policing responses, SPRs, are teams of crisis intervention specialists and police mental health corresponders who are trained to link mentally ill offenders to treatment alternatives without fear of arrest. Another example is outpatient competency restoration, which allows defendants who are found incompetent to stand trial due to mental illness to receive treatment in the community instead of in a state hospital. Specialized prison units are designed to provide more humane and effective care for inmates with mental illnesses who cannot be diverted from incarceration. They offer intensive mental health services, such as medication management, individual and group therapy, and case management, in a separate and secure environment within the prison. They also provide staff training, peer support, and re-entry planning to help inmates cope with their conditions and prepare for their release. Research has shown that specialized prison units can reduce disciplinary infractions, violence, self-harm, and segregation among inmates with mental illnesses. More funding for psychiatric facilities is essential to increase the availability and accessibility of mental health care for people who need it. Many people with mental illnesses end up in jail because they cannot afford or access treatment in the community. This is partly due to the deinstitutionalization movement that began in the 1960s, which closed down many state psychiatric hospitals without providing adequate alternatives. As a result, there is a shortage of beds, staff, and resources for people with serious mental illnesses who require inpatient care. Increasing funding for psychiatric facilities would help reduce the demand for jail beds and provide more options for diversion and treatment. These are some of the alternatives and reforms that have been proposed or implemented to address the problem of jailing the mentally ill. They aim to provide more humane and effective solutions that respect the rights and dignity of people with mental illnesses, while also enhancing public safety and saving taxpayer money. By investing in these alternatives and reforms, we can create a more just and compassionate society for everyone.